Hello, my name is Antoanela Garbacea, and today we're going to speak about a case presentation. It's an interesting one. Our lady patient presented with inability to chew. She's not able to be confident about her bite. She's wearing all bridges in the back of her mouth, upper and lower. And when we took a set of radiographs, we observed that there is recurrent decay. There is decay underneath her bridges, and her bridges were loose. So we were, in a way, speaking about removing those bridges and find out what's underneath. And many of those situations, when there is decay underneath the bridge, we're probably losing some of those teeth. So this is what happened. We took a full set of radiographs. We started removing the bridges, and we found out that underneath those bridges, teeth are hopeless. So we presented a treatment plan, and we decided to remove some of those restorations and remove some of those failing teeth, the root canal treated teeth that are hopeless. In completing this treatment plan, considering aesthetics as one of the goals besides chewing, a beautiful smile, we decided to replace all the maxillary crowns, considering that some of the marginal integrity was missing around some of the present veneers. And we consider also redoing the root canal on tooth number 5 and placing a cast post. In those situations, the way we treat those patients, and it's good information for everybody to know, that we are using provisional restorations. We place temporary crowns and we work underneath the temporary crowns for as long as it's needed. So in this situation, we place an implant in position of number 4 and a cast post in number 5 with the redo of the root canal. This side is very healthy. On the upper left side, we decided to do a sinus graft, lateral window, and place 2 implants. On the lower left side, we lost the molar and the premolar to vertical fracture and severe decay, and we placed 2 additional implants. Okay, this is the plan to restore a very good, strong, stable bite in the posterior area. And then the patient really wanted to remove the present veneers, and we went ahead for the upper teeth, for the maxillary teeth, and consider a new restorations that will make her smile even brighter and will even out with a new back teeth. We are using digital dentistry in our office, and you can see here this is a trio scan, including custom abutments for the implants and the cast post for number 5. All the preparations are considered done. The integrity and the health of the soft tissue can also be appreciated. So gums are healthy, teeth are healthy, implants are healthy, okay? And what we have for the lower teeth, we have 2 implants and we have a couple of crowns as well. Patient desired to maintain her lower front teeth, and we only did teeth whitening to just try to match the shape. So ultimately, a digital bite or a physical bite can be taken in order to articulate the upper and the lower jaw together. In our office, we're milling from PMMA. We like BL1, BL2 multi-layer. It is a very good product. It is usually milled in 2 or 3 pieces. For the upper and the lower teeth, we like to separate the implant restoration from the natural teeth, even in provisionals when we make temporary crowns. And you can appreciate the beautiful design and the accuracy of our scanners. What has been decided? So for the back teeth, we're going to use a stronger material, which is a traditional zirconia material. And for the anterior restorations, we're going to do a cubic zirconia layered restorations, which are our veneers. Beautiful smile together, accomplishing the goal of restoring a beautiful aesthetics, and at the same time having a very solid, very strong bite, and the patient can enjoy any type of food she likes. And thank you for being with us today, and this concludes my presentation. Good luck to you.